Hello everyone, myself Samir Adhikari. I will be talking about the central nervous system, the CNS. It consists of two things, the brain and the spinal cord. And we all know that the meninges is the most covering of the CNS. It covers the brain and the spinal cord. And it consists of three layers, from outward to inward. The outermost layer is the dura mater. The middle layer is arachnoid matter and the innermost layer is the pia mater. Talking about the dura mater, it is hard, tough, and rigid. Meanwhile, arachnoid matter, as the name suggests, it is the spider-like, and it lies in between the dura mater and pia mater. And talking about the pia mater, it is the innermost layer. It is soft, elastic, and highly vascular. And here comes the infection of the CNS or the brain or the meninges. What are the possible infections that a brain or the meninges could deal with? I would like to tell some. So some of them include the meningitis, encephalitis, then the tuberculous meningitis, the brain abscess, parasitic infection, and many others. And mainly today I will be talking about the meningitis. What is meningitis? It is a serious condition, okay, in which there is inflammation of the meninges. Based on duration, it is classified as acute, subacute, and chronic meningitis. Meanwhile, based on etiology, it is classified as based on etiology. No? Then if it is caused due to the viral, then it is termed as viral meningitis. If it is caused due to bacteria, bacterial meningitis. If it is caused due to fungal and parasitic respectively, then it is termed as the fungal meningitis or the parasitic meningitis. Among all these meningitis, the most common type of meningitis which is seen in the individual is the viral meningitis. The bacterial meningitis is less common in comparison to the viral meningitis, but the consequence of the clinical features shown by the bacterial meningitis is much more severe, which we'll be discussing in the upcoming portions. And here we will be dealing with the causative agent of the meningitis, the pathogenesis of the meningitis, the clinical feature which is seen in the meningitis, and the preventive measure that can be taken by an individual for the prevention of meningitis, either in the initial phase of the suffering of the meningitis or at the later stage when the clinical feature become much more severe. Or we can also talk about the issues like the ways to prevent the vertical transmission of meningitis, which my dear friend will be discussing in the later portion. Until now, thank you. Please don't skip the video. And are you ready for the next?
Hello, I'm Lakshman Acharya and I'm going to discuss briefly about the meninges. What is meninges? Meninges is the protective coverings of the brain and the spinal cords. There are three layers which are dura mater, arachnoid mater, and the pia mater. So what is dura mater? Dura means the tough. This is the tough, durable, and the thickest outermost covering of the brain. It is further divided into two layers. For one is industrial and the next is meningeal. Industrial layer is also called the inner periosteum because it lies on the inner aspects of the cranial bones, and the meningeal layer is the true dura mater. The separations of these two layers forms the subdural venous sinuses, and the meningeal layer forms the dural folds, which provides partitions of the cranial cavity and prevents the displacement of the brain. These folds are falx cerebri, tentoterium cerebelli, falx cerebelli, and the diaphragma sella. The next is the arachnoid mater, which is the middle thin and transparent membrane. It is separated from the dura mater by the subdural spaces and the pia mater by the subarachnoid space. Here, the cerebrospinal fluids of the brain and the spinal cord flows in the subarachnoid space. In certain areas, arachnoid projects into the venous sinuses and forms arachnoid villi, and with the advancement of the age, this arachnoid villi enlarge in size and forms pedunculated tufts, which are also called as arachnoid granulations. Innermost layer, which is a pia mater. Pia mater is the thin, transparent, and a vascular layer which is closely adherent to the brain and the spinal cords. There is a telachoroidea, which is formed by the pia mater when covered with the ependymal cells, it forms the choroid plexus, which forms the cerebrospinal fluids. Um, this arachnoid material and the pyometers are thin, so they are collectively called as leptomeninges, and the durameter is called pachymenings. So talking about the deployments of this layer, durameter is developed from the mesodermal layer, whereas the arachnoids and the pyometers are developed from the ectodermal layers. Thank you.
Namaste everyone, I am Vishal Banmala. I am going to talk about the cerebrospinal fluid. It is clear, colorless and transparent fluid. It is produced by ependymal cell in choroid plexus. Let's talk about the composition of cerebrospinal fluid. 99% of cerebrospinal fluid is water. Organic and inorganic constituents are also present in cerebrospinal fluid. Ions are present as inorganic constituents in cerebrospinal fluid, like sodium, potassium, calcium, magnesium, phosphate, sulfate, and bicarbonate ions. As an organic constituent, it includes protein, glucose, creatinine, cholesterol, urea, uric acid, etc. Let's talk about the function of cerebrospinal fluid. It protects the brain and spinal cord from trauma and injury. It supplies the nutrition to nervous system. CSF also maintains the intracranial pressure. CSF provides the buoyancy and brain floats into the CSF. CSF also helps in removal of cerebral metabolic waste products. Thank you.
I am going to talk about the causes of meningitis. The bacterial causes of meningitis are Haemophilus influenza, Listeria, Meningococcus, Mcoms, Pneumococcus, and certain Streptococcus. Not only the bacteria, viruses are also responsible for causing meningitis. They are enterovirus, arbovirus, influenza virus, herpes simplex virus type 2, varicella zoster, HIV, Mumps, and the measles. Along with the bacteria and the virus, there are some fungi which are responsible for causing meningitis. They are Cryptococcus, Histoplasma, Aspergillus candida. This was all about the fungi that are responsible for causing meningitis. Now the parasites that are responsible for causing meningitis are Toxoplasma, Hydrate, Amoeba, Plasmodium, and Cysticercosis. Besides that, there are some other causes of meningitis. They are physical injury, cancer, certain drugs like NSAID, head injury, cerebral abscess, and middle ear infection. This was all about the causes of meningitis. Now, what are the risk factors of meningitis? The risk factors of the meningitis are cancer, immunocompromised state like in the patients of HIV and AIDS, sinusitis, age extremes like in older patients, otitis like in children, head trauma, parameningeal infection, alcoholism, respiratory infection like systemic respiratory infection, neurosurgical procedures, and splenectomy. Thank you.
Clinical features of meningitis varies according to the age. Signs and symptoms of meningitis in infant and neonates are high-grade fever, constant crying, very sleepy or irritable, being inactive or sluggish, not waking to eat, poor feeding, vomiting, bulging of the frontinelli, stiffness of body and neck.
Meningitis can have symptoms similar to that of flu, ease or distance. The symptoms might set within few hours to over a day or a week. The symptoms include severe headache, high fever, and neck stiffness. These are due to the stretching of the inflamed meninges and the nerve roots. Other symptoms include loss of appetite, seizures, nausea and vomiting, rashes in case of meningococcal meningitis.
Hello and namaste everyone. It's me Raj Basil and I will be talking about the pathogenesis of meningitis. So as we've already discussed, there are two major pathogens that cause meningitis. They are Streptococcus pneumoniae and Neisseria meningitidis. As well as in infant, it is caused by Streptococcus agalacti. So these two pathogens, they invade our nasopharyngeal tract, and from that nasopharyngeal tract they get entry into our cells via the formation of vacuole. So once they are into the bloodstream, they actually evade the phagocytosis of the inflammatory cells because of presence of capsular antigen. So once they are into the bloodstream, they may have two ways of infection. First of all, they may invade into the cerebral capillaries, and from that cerebral capillaries via the cells they may now enter into the cerebrospinal fluid, or on the other note, they may actually enter into the cerebrospinal fluid from the other ways of hematogenous spread as well. So once the invasion is into the cerebrospinal fluid, that is the subarachnoid space, now there occurs the rapid multiplication of the bacteria in the subarachnoid space as there is the minimum amount of inflammatory cells present in cerebrospinal fluid. So this will cause the production of inflammatory cytokines and chemokines in the subarachnoid space. So these are produced actually by astrocytes, microglial cells, and other monocytes that are present in the surrounding cells of the lining the subarachnoid space. So due to the presence of most commonly tumor necrosis factor alpha and interferons 1A, it causes it induces the inflammation in the meninges, which will lead to several other symptoms of meningitis. First of all, it will cause the alteration of the blood-brain barrier, which will lead to the cerebral edema and also vasogenic edema, which will further in turn complicate into seizures or any other kind of epileptic disease. Similarly, also there is the adhesion of the leukocyte into the cerebral capillaries, which will further lead to cerebral ischemia and other kind of complications could be there. Similarly, as there is the inflammation is induced, there may be production of reactive amino acids or reactive oxygen species and nitrogen species, which will further lead to cell injury and damage. So these all things when they are complicated into each other, they will lead to meningeal inflammation and further lead to other complications like ultimately which may lead to epilepsy and coma as well. So this was about the pathogenesis, which will lead to the further clinical features will be discussed by my friend. Thank you.
Namaste, my name is Suyog Bhandari and I'm going to be talking about the pathogenesis of meningitis. As we already know that meningitis can be of various types like bacterial meningitis, viral meningitis, parasitic meningitis, or even fungal meningitis in some cases. So talking about the pathogenesis, first we need to know how does the bacteria or the bacteria, virus or the causative agent enter to the meninges and cause its inflammation. So we are going to be talking about how the bacteria transmigrates from the site of infection to the area of the meninges due to various infections like infection of facial sinuses, respiratory infections, chronic otitic conditions like chronic suppurative otitis media, genetic cribriformal defect, or some other defect in the cranial bones and sinuses may lead to the transmigration of the bacteria from the primary site of infection to secondarily to the meninges through the blood vessels, right? So furthermore, talking about it, when these bacteria, when they enter inside the brain parenchyma, they start infiltrate into the subarachnoid space and start multiplying in the space itself, due to which there again inflammation of the meningeal layers and space in the subarachnoidal space inflammation start to occur, due to which there is a release of various cytokines and inflammatory mediators in the space itself, leading to the increased permeability of the blood-brain barrier, due to which there is leakage of the protein, CSF protein outside through the subarachnoid space, causing cerebral edema and interstitial edema in the space itself, which causes increase in the intracranial pressure, which increases the pressure to the cranium itself, finally causing meningitis. Thank you.
Good morning everyone. Now I will be continuing with my topic, that is lab diagnosis of the meningitis. For the ideal sample for the sample collection for the meningitis is CSF fluid, and other sample to be collected are blood, urine. The CSF sample should be collected by lumbar puncture. The collected sample is divided into 3 containers. One is for the CSF analyzing, another is for the CSF microscopy, and other is for the CSF culture. In case of the CSF analysis, we usually do CSF pressure, total leukocyte count, total protein count, total glucose. And in case of the CSF microscopy, we either do the gram stain or the acid fast bacilli. In jet staining, in case of the gram stain, the Neisseria meningitis appear as a gram negative diplococci, whereas the Streptococcus pneumoniae appear as a gram positive cocci, whereas in case of the Haemophilus influenza, it appear as a gram negative coccobacilli. E. coli appear as a rod-shaped bacteria. And in case of the jet staining, Mycobacterium tuberculosis appear as a acid-fast bacilli. For the CSF culture, either we do the blood agar, McConkey agar, or the chocolate agar. If there is a fungal infection, then we do the Sauber dextrose agar culture. And in case of the parasitic, we do the tissue culture or the animal inoculation. And after the CSF analysis, culture, and the microscopy, we go for the serology of the serology. In this type, we mainly see for the capsular antigen, and in case of the molecular diagnosis, we go for the PCR technique, and in case of the radiological examination, we mainly see in case of the radiological examination bacterial meningitis. CSF sample that is collected should not be kept for more hour in a cold temperature, because the delicate organism like Haemophilus influenza are delicate to kill, so it is incubated at the 37 degrees Celsius. That's all.
Greetings everyone. Today I'll be talking about prevention of meningitis. We can prevent meningitis by avoiding the causative agent itself, by washing hands, by maintaining distance with the patients who are infectious, and by isolating the patient. Now coming on to mass chemoprophylaxis. Mass chemoprophylaxis should be restricted to close and medically supervised community. In mass chemoprophylaxis, we use drugs like ceftriaxone and ciprofloxacin. We can also manage by managing the mental infection and prenatal screening during 35 to 37 weeks of pregnancy. In this, we can screen for group B streptococci, syphilis, and hepatitis. Talking about vaccination, we have two types of vaccine. One is meningococcal polysaccharide vaccines, and other is polysaccharide protein conjugate vaccine. In our country, pneumococcal vaccine is only vaccine against causative agent of meningitis that is in our routine vaccination program. Thank you. This is all about prevention of meningitis.